become very common procedure nowadays. In the past, about maybe 20 years ago, it used to be very complicated, difficult procedure, done only few centers. Now, it's become very common. It's like a cataract operation nowadays. And just to let you know, last year about 1,20,000 primary knee replacement done in India. And why we are doing a revision knee replacement? Because these joints not going to last for the rest of their life. At some point, they need taking out and putting them back. And presently, we are doing about maybe 10% of revision surgeries. That means if we do 125, maybe about all over India, about 10,000 revision knee replacements are done. Just to see the problem, this was, I think, a very good study published in Times magazine. By 2017, India will be the biggest country hosting osteoarthritis knee. Like diabetes, we will host the maximum number of osteoarthritis knees in India by 2017. Just to see the statistics, we have population about 1.3. 2% of the population at any given time suffers with osteoarthritis. That means about 25 lakh population. So 25 lakh population need knee replacements at any given point. We are only doing probably about 5% of them because of various reasons, probably because of their affordability and other factors. Awareness is not there because most of the time knee replacement, people get worried if they do not have enough knowledge about the results and its outcomes. And what happens is, of this you can see 0.5 million people would need revision replacement at some point. And unfortunately what happens is, across the world, the common cause for revision is loosening over a period of 15 to 20 years. That's a normal course of a joint, because wear and tear of the joint, the artificial joint, wear and tear gets loose, we have to revise. India, unfortunately, infection is the commonest cause for revision. And infection, what happens, it won't wait 10 to 15 years. We may have to do within a year, within 6 months, within few months time or a few years. Because whenever infection happens, we have to take it out and put it back. And the revision for infection, the case we are doing today, I'm going to tell you about the conference and course in a minute. For an infection, we have to do revision, we have to do 2 operations. First operation to control the infection, second operation to put the implants. So it's more expensive to do a revision. That's why we have to be very careful to do revision in a proper way. And when we get the revisions, their analysis, their data, we can go back and see what went wrong in the beginning, so that the primary operation itself we can do in a better way to prevent any kind of this complication. As you can see, the primary operation, we do simple implants, that's osteoarthritis knee, and replace knee. This is a standard implant, and roughly this operation about maybe 2 to 2.5 lakhs. Whereas, of course, we in India, the other problem would be they do not come in the beginning, they wait very long time, and they come with difficult deformities. We are talking to German surgeon, we showed some of these slides this morning during discussion. He was saying they would do a revision operation for these cases because it's difficult to reconstruct these deformities with the primary implants. But most of the time, we are able to do with the primary implants because compared to them, we have more experience or exposure for a difficult deformity of the knees in the first place. And of course, for revision, common causes all over the world, wearing of artificial joint, common cause. Second is infection. Probably India, I think they're equal. Infection and loosening would be almost equal number. For revision, probably for a primary operation, we have 3 trays in the operation theatre. For revision, we need so many instrumentation. Probably we need about 15, 16 trays in the operation theatre. So it's more expensive to get the instrumentation, and most of the time there is significant bone loss because of wear and tear or infection. So we need more reconstruction of the joint, more reconstruction of the bone. That's why it will add to the cost. We have to use implants like this. In a primary operation, simple implant, but revision, because the bone itself doesn't support, so we have to give extra rods, special implants to support the joint. And the functional outcome is not as good as a primary one, because primary we say it will last about 20 years. Revision, if it lasts about 10 years, that's very good result. That's why we have to focus on preventing revisions for reasons which can be avoided at the time of surgery, especially infection. Can you take that for now? So the whole idea of we have organized 1-day knee revision course today with Dr. Gresham. He's from Munich. He's operating. I think he will come soon here. Munich, they have excellent center for revision knee replacement, and we want Mrs. Sangeeta Madam is going to tell about this one. The whole idea is to have a change program with him, to have a setup here, so that we are in par. As far as primary is concerned, we are in par with the rest of the world. But revision, we are still growing, still learning. Our expertise, our facilities may not be as good as Europe or America. So unless we have some partnership, people like him with a good center, we won't be able to reach that stage very soon. So the whole idea of organizing this workshop symposium is to develop this center, and probably we will have these courses every 6 months to train our surgeons, to share the experience, and to see how we can prevent revisions and to do revisions at a lower cost. Just to give an idea, in America, $25,000 is primary knee replacement. Revision, it will cost up to $70,000 to $80,000. Even in India, it will cost about 3 times a normal knee replacement. With that, I think I will stop here. I will ask our Madam, Mrs. Sangeeta Madam is going to briefly address you.